Occupational English Test. Listening Test. This test has 3 parts. In each part you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for extract 1. Extract 1. Questions 1 to 12. You hear a doctor talking to a new patient. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning. May I have your name, please?
Hi, my name is John.
Hello, John. Nice to meet you. Can you tell me your age and why you are presenting to the hospital today?
I am 35 years old and I have been experiencing severe pain in my lower back and abdomen for the past few days.
I see. Have you had any medical conditions or surgeries in the past?
Yes, I have a history of high blood pressure and I had surgery for a hernia a few years ago.
Thank you for letting me know. Does anyone in your family have a history of kidney stones or other related conditions?
My father had kidney stones a few years ago.
All right. Have you had any allergies to medications or food in the past?
No, I haven't had any allergies before.
Okay. Can you describe the symptoms you are experiencing in detail and how they have progressed over time?
The pain started in my lower back and then moved to my abdomen. It's a sharp, intense pain that comes and goes. It has been getting worse over the past few days and I have also noticed blood in my urine.
I see. Let me take your blood pressure and check your vital signs. Your blood pressure is slightly high, and I'll need to run some tests to determine the cause of your symptoms. Based on your symptoms and medical history, I suspect that you may have kidney stones.
Oh no, what does that mean?
It means that there are mineral crystals that have formed in your kidneys and are blocking your urinary tract, which is causing the pain and blood in your urine. We will need to do some imaging tests, such as a CT scan, to confirm the diagnosis and determine the size and location of the stones. Depending on the results, we may need to provide you with medications to manage the pain and possibly surgery to remove the stones.
I see. What kind of nursing management and medications will I need?
You will need to drink plenty of fluids to help flush out the stones, and we will also provide you with pain medications such as ibuprofen or acetaminophen to manage the pain. If the stones are too large to pass on their own, we may need to use a procedure to remove them. We will also monitor your blood pressure and kidney function closely throughout your treatment.
Thank you for explaining everything, doctor.
Of course, my pleasure. We will run some tests to confirm the diagnosis, and then create a personalized treatment plan for you. Please follow all of the instructions we provide you, and don't hesitate to contact us if you have any questions or concerns.
Sure, thank you, doctor. Can you tell me more about the imaging tests that you mentioned earlier? What does a CT scan involve?
Of course. A CT scan, or computer tomography scan, is a non-invasive imaging test that uses X-rays and computer technology to create detailed cross-sectional images of your body. For this test, you will lie on a table that slides into a large, donut-shaped machine. The machine will take multiple X-ray images from different angles, and a computer will combine them to create a 3D image of your kidneys and urinary tract. The scan usually takes about 30 minutes, and you will need to hold still during the procedure.
That sounds like a complex procedure. Is it safe?
Yes, CT scans are generally safe, but they do expose you to a small amount of radiation. However, the benefits of the scan usually outweigh the risks, especially when we need to make a diagnosis and plan treatment. We will take all necessary precautions to minimize your radiation exposure, such as using the lowest possible dose of radiation.
Okay, thank you for explaining that to me. What other tests will I need to undergo?
We will also need to take a urine sample to analyze the presence of any blood or crystals, which can help confirm the diagnosis of kidney stones. We may also order blood tests to check your kidney function and electrolyte levels, as well as a renal ultrasound to get a clearer picture of your kidneys and urinary tract.
I see. What about surgery? Will I need to have surgery to remove the stones?
It depends on the size, location, and number of the stones. If the stones are small enough, they may pass on their own with adequate hydration and pain management. However, if the stones are too large or are causing complications such as infection or kidney damage, we may need to perform a surgical procedure to remove them. There are several types of procedures, such as shockwave lithotripsy, ureteroscopy, or percutaneous nephrolithotomy, depending on the specific case.
That makes sense. Is there anything I can do to prevent kidney stones from forming in the future?
Yes, there are several lifestyle changes that you can make to lower your risk of developing kidney stones. Drinking plenty of fluids, especially water, is one of the most effective ways to prevent stones from forming. You should aim to drink at least 2 to 3 liters of water per day, and more if you are physically active or live in a hot climate. You can also reduce your intake of sodium, animal protein, and oxalate-rich foods such as spinach, rhubarb, and chocolate. In some cases, we may also recommend medications to help prevent stones from forming.
Thank you for all of this information, Doctor. I appreciate your time and expertise.
You're welcome, John. It's important that you understand your condition and treatment options so that you can make informed decisions about your health. Please don't hesitate to ask me any questions or concerns you may have during your treatment.
Now, look at the notes for Extract 2. Extract 2. Questions 13 to 24. You hear a consultation in GP's office. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning. May I know your name, please?
Hi, my name is Sarah.
Hi, Sarah. What brings you to the hospital today?
I have been experiencing bleeding issues for a few days now and it has been getting worse.
I see. Can you tell me more about your symptoms and how they have been progressing?
Yes, it started with minor bleeding from my gums and nose, but now I am also experiencing heavy menstrual bleeding and blood in my urine.
I see. Do you have any history of bleeding disorders or clotting issues in the past?
No, I don't have any such history.
Okay. Can you tell me about your past medical history?
I have a history of hypertension and diabetes.
All right. Do you have any family history of bleeding disorders or clotting issues?
No, I don't have any such history in my family.
All right. Have you ever had any surgeries or dental procedures in the past?
Yes, I have had a few surgeries in the past and some dental procedures as well.
Okay. I will need to do a physical examination and check your vital signs. I will also need to order some tests to investigate the cause of your bleeding disorder. Your blood pressure is slightly elevated at 140/90 mm of mercury and your heart rate is 90 beats per minute. Based on your symptoms and examination, I suspect that you may have a bleeding disorder. We will need to do some tests to determine the exact cause. We will also need to check your blood counts, coagulation profile, and kidney and liver function tests.
Okay, doctor. What is the treatment for this condition?
The treatment will depend on the underlying cause of your bleeding disorder. We will need to wait for the results of the tests to determine the appropriate treatment. In the meantime, we may need to give you some medications to control the bleeding.
Okay, I understand. What kind of medications would that be?
We may need to give you medications that can help slow down or stop the bleeding. This can include drugs such as tranexamic acid or desmopressin. These medications can help improve clotting and prevent excessive bleeding.
How long will it take to get the test results?
It may take a few days to get the test results back. Once we have the results, we will be able to determine the cause of your bleeding disorder and provide appropriate treatment. In the meantime, we will do everything we can to manage your symptoms and prevent further bleeding.
Can I still go to work while waiting for the test results?
It would be best to take it easy and avoid any activities that may cause injury or bleeding. You should also avoid taking medications such as aspirin or nonsteroidal anti-inflammatory drugs, NSAIDs, that can increase the risk of bleeding.
Okay, I will keep that in mind. Is there anything else I should be doing to manage my symptoms?
It's important to stay hydrated and get plenty of rest. You should also avoid any strenuous physical activity or heavy lifting. If you experience any severe bleeding or have trouble breathing, you should seek medical attention immediately.
Thank you, doctor. I will do my best to follow your instructions and take care of myself.
You're welcome, Sarah. We will do everything we can to help you through this. If you have any further questions or concerns, please don't hesitate to ask.